Hello, and welcome to ANCOR's Get Ready for Hill Day 2015 presentation. My name is Catherine Burland, and I'm ANCOR's Director of Public Policy. In a little bit, I'll be joined by Esme Grant, who is our Senior Director of Government Relations, and Gabrielle Sedor, who is our Chief Operations Officer. They're going to help me demonstrate some best practices to use before, during, and after your Hill visits. In this training, we're going to cover several things. In part one, we'll go over how to make contact with the office, how to set an appointment with your elected officials, what to do before, during, and after your meeting. In part two, we'll go over the specific talking points for 2015. This year, we have a focus on home and community-based services, HCBS, Medicaid and federal funding, housing, direct support professionals, DSP, workforce issues, and then of course the DSP Week Senate resolution. There are 5 steps to a successful congressional visit. Step 1 is to locate the contact information for your congressional office. Step 2 is to call or email the office to set up an appointment and identify the correct staff person for your issue. Step 3 is to plan out your visit. When you're going in a group, it's a good idea to focus on what issues you're going to talk about and decide who's going to say what and in what order. Step 4 is to plan your travel to the office. And step 5 is your follow-up. After the meeting, send a thank you email and any information that you told the staffer or member that you would get during the visit. This year, we're excited to roll out our new ANCOR Amplifier site. This is the site that we'll use for action alerts, as well as information on various policy issues. It also has a powerful tool to help you contact your senators and representatives. The website is amplifier.ancor.org. You can go to the home page, shown here. You can put your zip code into the search box and click search, and that will take you to a page that has all of your elected officials in one place. You'll see federal, state, and local representatives. When you click on any one of your representatives, you'll get another page that will contain their official government website, biographical information, their committee assignments, and complete local and federal office contact information. You may want to bookmark this page for easy reference. And the very top of the page includes a link to your representative's official website. Now, to request an appointment, you want to think about the best time to do it. It's best to request your appointment between 3 and 6 weeks prior to your meeting. If you miss that time frame, don't worry, just call or email now. Sometimes you can get an appointment last minute, so keep calling if you aren't able to get one right away. If you didn't make appointments before the conference, you can always stop by the office and leave materials and sometimes speak to a staffer. Congressional offices tend to love their constituents, and oftentimes they'll have some goodies that they'll send you away with. Before you make contact, it's a good idea to visit your senator or representative's website. That way you can know ahead of time where they stand on the issues that are important to you. It's a good idea for you to know ahead of time what you want the meeting to be about. Are you going to focus on Medicaid, housing, or workforce issues? Knowing what you're going to talk about will help the scheduler ensure that the correct staff person will handle your meeting. It's a good idea, if you're able to identify a specific staffer that handles health or Medicaid issues, so you can ask for them by name. Once you've done that, make your call. When possible, call the scheduler directly, or you can send an email. Plan to follow up with a call if you haven't heard back in a couple of days. If you still need to make your appointments, we've made it easy for you to use ANCOR Amplifier to do it. You just click the It's Time to Schedule Your Hill Meetings link. You can get to it from the front page, and you can send an email directly to your representatives asking for a meeting on May 6th. That's our Hill Day in conjunction with our conference this year. You simply enter your information, and you can click the Remember Me checkbox so that the system will remember you the next time you come in, and then click Submit. That will take you to the next page, which has the action alert text. You can edit and personalize this text, or you can leave it as it is. It's a good idea to personalize it, though, to include your agency's name, how many people will be coming with you, and some specific times that work for you on May 6th or whatever date you can make. You can also use the instructions and talking points over on the side of the screen for additional guidance to help you with making your appointments. When you're done with that, you hit submit and a message will be sent automatically to your senators and representative. Now, as you get ready to prepare for your meetings, you might have a few questions. One question that comes up frequently is whether it's important to meet with your actual member of Congress or with someone on his or her staff. So, the question is, should you insist on meeting with your member instead of a staffer? The answer is no. Members of Congress have exceptionally busy schedules and simply cannot take every constituent request for a meeting. Additionally, because they are so pressed for time so often, you're less likely to have as much time with a member as with one of their staffers. And you might find even if you do sit down with the member, he or she may be frequently interrupted to take care of business or may be easily distracted. Of course, even the best members can't be subject matter experts on everything, so they really do trust and rely on their staffers to do research, meet with constituents, and make informed recommendations on everything from legislation to propose, to how to vote, to what local events to participate in. Having a good relationship with the right staffer for your issue will often get you further than meeting directly with your member. Now, I know what you're saying. You're saying, Catherine, okay, I get that, but this staffer looks like they're fresh out of college, or maybe they just graduated high school. Seriously, I'm meeting with Doogie Howser here. Are you sure I should take this meeting seriously with them? The answer is yes. Don't let their age or possibly casual dress and demeanor fool you. Congressional staffers tend to be bright, driven, and highly competent. Speak to them as you would to any other professional in that type of setting. You may also have some questions about whether it's best to meet with your senator's DC office or their local office. Most senators and representatives have not only their national office in DC, they also have a local office in their own district. And it's okay to meet with both of them, and I would encourage you to meet with both of them. Now, if you can't make it to ANCOR Hill Day this year, you have some options. The best thing about coming to DC, in addition to seeing the lovely cherry blossoms, the Smithsonian, and all the monuments, it's also a great way to meet with all of your elected officials in one trip. And you can often coordinate with other ANCOR members at our conference from your state to make your visits and really send a coordinated message. But if you aren't able to make it to the conference or to Hill Day this year, plan to make a trip to your member's local office. Now, you may be thinking, but I already have a good relationship with my local office. Why should I meet with national staffers too? Well, the answer is that your member has staff in both their local and national offices that may be focused on different areas and priorities. It's a good idea to foster strong relationships with all staffers, both national and local, that work on our issues. Staffers in local offices have a tendency to be more connected to local state politics. So they may have a better handle, a better take on what's going on in your state's legislature. Whereas staffers in the national office are more likely to see the bigger picture, to work on the national issues, and they're also more likely to interact with other members' staff, which is a very important relationship for advancing common goals at the federal level. They're both important and they should both be focused on. Now, the next thing you'll want to do to prepare for your meeting is to plan your travel. You'll want to plan how your group will get to the office, whether it be by metro, by taxi, or carpool. This year, our ANCOR conference is being held in the DC area, just south of DC. So you will need to take some form of transportation to get to the offices. They're not walking distance. ANCOR will have printed maps available of congressional office buildings, or you may locate them online. We also have a link to a very good map up on ANCOR Amplifier site, which I will give you again later on in this training. You'll want to plan to arrive at least 30 minutes in advance to allow time to get through security, locate the office within the building, and review your talking points with your group. You will want to do some prep work before your meeting. The first thing to do is to check out your member's website. It's a good idea to know what committees he or she serves on, what his or her voting record is, specifically on important issues to us, and what their positions are on our key issues. Having a good familiarity with where your member stands with these issues will really help guide you as you go through the meeting. If your member has shown strong leadership on key issues, it's a good idea to start out right away thanking them for any leadership that they've shown and any support that they've shown on our issues. You'll want to review ANCOR's information and talking points so that you can get a better understanding of key issues. You'll want to decide within your group what you're going to talk about, what order you should go in, and assign roles in advance. It's also a good idea to have a discussion about who should field which questions that come from members or staffers. In your meeting, you'll want to use personal stories as much as possible. Try not to read from your materials, handouts, or talking points. Just be yourself. On the next slide, we're going to have a role play that will demonstrate how you can conduct a pre-meeting plan.
I'm really looking forward to our meeting with Senator Smith today. We have so many issues to talk about, and he can really help us out.
Great. But this is my first Hill visit. What can I expect?
Well, I always like to plan ahead and talk and discuss what each one of us is going to talk about, as well as make sure we have our ask down. We have so many issues here, but we don't want to overwhelm the staff. We'll want to focus.
Great. Well, I'd really like to talk about wage issues. I really love the work that I do for HOPE programs, but if we get cut, I'll never see a wage increase. So I'd really like to share my story.
That's a great idea. Staffers and members of Congress really appreciate firsthand stories. So how about I start with a description of our program and how we're funded. Let's focus on the cuts to Medicaid, and then you can share your story and how those cuts impact you and those that you work with.
Sounds good.
Great.
Oh, it looks like it's time to go in and let them know we're ready to meet with Kathy.
Great, let's go. Okay.
During your meeting, it's most important to relax and be yourself. I know it's easier said than done, but the most important thing is to relax and tell your story. Maintain a polite, respectful, and friendly tone. Stay on point. Remember to pick stories that relate to the issues you've decided to discuss. Anecdotes are great, but you want to make sure that they illustrate your issue. If a staffer or a member asks you a question that you don't know the answer to, that's okay. It's okay to say you don't know the answer, but you can find it. Don't make something up. Just offer to find the answer and follow up with it in your follow-up email. Also, don't get tripped up on trying to recite facts and data that you aren't familiar with. Statistics and data and numbers are great, and they're great tools, but we have that on your leave behinds, and you can include some of that in your follow-up. During your meeting, really focus on telling your story. That's what's going to make the biggest impact. The next slide will show a role play of how to actually conduct a meeting.
Hi, welcome to Senator Smith's office. I'm Catherine. It's very nice to see you. I hear you traveled from our home state, North Alexandria, to get here.
Yes, we did, and we're pretty happy to be here considering North Alexandria University won the NCAA tournament. Go Turtles!
I know, what a great game. So, what brings you all in today?
Well, Kelly and I are here today to speak to you about cuts to the Medicaid program. But first, let me introduce ourselves. I'm Vanessa Grant, and I run the HOPE program in North Alexandria that services over 2,000 individuals with intellectual and developmental disabilities. We support them during their daily activities, with work support, everything they need to do to go about their daily lives in the community. Our program receives funding through Medicaid dollars, which funnel down to North Alexandria through the Medicaid Home and Community-Based Services Waiver Program.
And I'm Kelly Booker, and I'm a direct support professional, and that means that I work one-on-one with the people that HOPE program supports. And I've been there for about 16 years.
So Kelly and I wanted to share a little bit about our work and why Medicaid funding is so essential to our state, because without it, we could not provide these services. As you know, our state no longer has state-run institutions for people with disabilities, and instead we serve them in the community. Our program makes sure that people can live full, meaningful lives in the community. It's really Medicaid funding that has made our program possible, so that people can live with their families or in homes in the community and have access to work, transportation, and other daily needs. It's so exciting that 25 years after the Americans with Disabilities Act, we can now say that people with disabilities have access they need to live in society. But if Medicaid is cut or turned into block grants, programs like ours will suffer.
Yes, and Senator Smith understands that, but we also have to balance that against solutions to the national deficit.
We fully agree with the senator, and we believe in balancing the budget. But it's important to know there's actually a lot of data showing that community services are far less costly than institutional services. We've worked hard to get to this point with Medicaid, and any disruption to it could potentially revert us back.
I'd like to see that data. Can you send it to me?
Oh, I certainly will. We're also struggling in the state with high turnover and the inability to pay important individuals like Kelly, who dedicate their lives to supporting the people we serve. Kelly actually can elaborate on that a bit.
Sure. So as I mentioned, I've been with HOPE programs for about 16 years. I've actually been supporting the same 3 individuals for the last 10 years. It's 3 gentlemen. They live together in a group home, and one of them actually used to live in one of the state's institutions. 2 of them used to live at home with their parents, but they were really isolated there. But now, together in the group home, we volunteer in the community. They work at the local bakery. It's so great. I love working with these guys, but it's tough. And when you're in this line of work, you often dedicate your life to it. And I make above minimum wage. But I know that HOPE program would like to pay me more. But it's really hard to do that, and you have to retain staff that are skilled and that they're professional. And I've seen a lot of my coworkers leave, not because they want to, but because they need higher paying jobs. And I'm concerned that if Medicaid funding is cut any further, it'll limit what HOPE can do for staff like me and my colleagues. And I can tell you that the lives of the gentlemen that I work with really depend on it. They matter a lot to me, which is why I'm here today.
Okay, well, thank you so much, Kelly. I really appreciate you sharing your story with me today, and I'll make sure to pass that on to Senator Smith. You mentioned something. Can you tell me what the average wage is for direct support professionals like you make in the state, and maybe what the turnover rate is?
I don't have that information with me right now, but I bet we could get it to you.
We can definitely get you some numbers from a survey that a number of programs like ours conducted in the state last year.
Great. Well, thank you both. Right now, as you know, the Appropriations Committee is working out the budget, so we'll have to wait and see what's there. The Senator has always been a strong supporter of people with disabilities, and I know he'll take your concerns into account, and I know he appreciates your sharing your story.
Great, thank you so much. We really appreciate everything that you and the Senator do.
Yes.
Here's my card and a 1-pager with our ask, as well as additional information about our program. I'll send you this electronically as well, and all the other information you requested. If you have any questions, just let me know. Thank you so much for meeting with us.
Thanks so much.
Thank you both, and I will walk you out.
Great.
When your meeting is over, plan your follow-up and next steps. Decide who will send a thank you email to the person you met with. Include any information you offer to follow up with, as well as electronic versions of any leave-behinds you have. Staffers greatly prefer electronic to paper. Snap a picture with your member or staffer if you can, or at least of your group before you leave the building. You can tweet it to @TheRealAnchor using the hashtag AnchorIgnite. And make sure to let Anchor know who you met with and how your meeting went.
Well, how do you think it went?
I think really well. She seemed really sincere about letting us, share our issues and letting the Senator know.
I agree. I'll send her a thank you email tonight. Thank you for meeting with us and sharing our stories with Senator Smith. And then I'll send her the data she wanted on community versus institutional living, wages and turnover, and also send her electronic copies of our handouts. I know staffers love electronic versus paper.
Can you CC me too, so she has my contact information as well?
Absolutely. All right, let's get to our next meeting.
All right.
Now that you know the key to having a successful Hill visit, I'm going to give you some background information and talking points on key issues that ANCOR is focusing on in this congressional session. As I go through this information, keep in mind that it's for your education and reference only. Don't feel that you need to memorize all of the talking points or all of the data that are contained in these next slides or in the printed and electronic materials that ANCOR will provide to you. The most important thing during your visit is to tell your story. All of the information that's contained in these slides will be provided in handouts that you can take to your congressional visits and leave behind after you meet with your staffer. So don't feel that you need to memorize every last bit. Just go in, relax, and tell your story. With that said, let's go ahead and look at the first issue. One of our major focuses this year is on home and community-based services, often abbreviated to HCBS. As you may know, in 2014, the Centers for Medicare and Medicaid Services, CMS, issued a rule that for the first time sets criteria and defines what is considered home and community-based services for the purpose of HCBS funding under Medicaid. The rule is used for residential and non-residential settings, and it requires outcome-oriented, person-centered planning. CMS has given states until 2019 to fully transition settings to meet the criteria of the HCBS rule. Additionally, the rule requires person-centered planning and sets criteria for what has to be in a person-centered service plan. Settings have a transition period of up to 5 years from the effective date of the rule, which was in 2014. The person-centered planning provisions, as well as conflict-free case management provisions under the rule, are effective now. ANCOR supports the rule and its goals, but recognizes there is much work that needs to be done among states and among providers to implement the rule and continue to have settings comply with HCBS expectations. It's essential that funding is adequate to ensure a smooth transition with no disruption of services for the people that we serve. Earlier this year, the Obama administration issued a budget proposal that would increase Medicaid funding for HCBS transition planning. We encourage you to ask your member of Congress to support the administration's proposal regarding HCBS Medicaid funding. Also this year, budget proposals came out of the House and Senate budget committees that proposed to convert Medicaid to a block grant system or impose per capita caps on Medicaid beneficiaries. What this means is that instead of the federal government matching state funds that are expended in the state Medicaid program, the federal government would instead give states a fixed amount of money to administer their plans. That amount would be lower than what states receive now. What this could mean for beneficiaries is that services could be disrupted and we might see waiting lists increase. Rather than doing this, we encourage you to ask your Congress member to reject any proposal to block grant Medicaid or that would impose per capita caps on Medicaid beneficiaries. Finally, home and community-based services are necessarily services that are administered in the community. What this means for the people that receive them is that they have to have safe, affordable, and accessible housing. There is a housing shortage in this country, and we'll go into more depth on that in a little bit, but for now, we ask you to ask your congressman to ensure that housing programs that benefit people with disabilities remain funded and accessible. Our next issue is Medicaid and federal funding, and although I'm talking about these as separate issues, they're all very interconnected. But as you know, Medicaid is a vital funding source for many people with disabilities. for HCBS programs and other programs that people with disabilities rely on. Medicaid is at risk of being converted to a block grant or per capita caps program, which, as I mentioned on the previous slide, means that the federal government would give less money to states to administer their Medicaid programs. States would have to then make up the shortfall, or if they're not able to cut services, change how people are eligible for enrollment, and ultimately it could hurt people that rely on these services. The President's budget would increase funding in key areas of Medicaid, not just in HCBS, but also other areas of Medicaid. Republican budget proposals, conversely, would decrease federal Medicaid funding significantly. Before I launch into the talking points, I want to give a little more background on what Medicaid is and what it isn't. You may find, especially for newer members of Congress or newer staff, that they don't really understand the difference between Medicare and Medicaid and may not understand which program funds which services. Medicare is wholly funded by the federal government. There is no state-federal partnership, unlike Medicaid. Medicare primarily serves older Americans. Medicaid, on the other hand, serves primarily people with disabilities, people of low income, and children. Because Medicaid is a state-federal partnership, both federal monies and state monies support the program. Many members of Congress may not realize that Medicaid tends to fund long-term supports and services. Often there's confusion with people thinking that Medicare is the primary funder of long-term supports and services. Understanding this difference is an important distinction that will help you be able to talk to your member of Congress and really underscore the importance of keeping Medicaid funded and viable to deliver vital services to people with disabilities. Now, because providers, ANCOR members, are funded primarily by Medicaid, they are not able to pass on increases in operating costs to the people they serve. The people that we serve tend to be lower income and tend to get most of their income from public sources such as Medicaid or possibly SSI. Because we can't pass on increases in operating costs, if there are policy changes that increase how much it costs to provide services, providers can't simply pass that cost along to consumers. Now, as I mentioned on the HCBS slide, we encourage you to ask your member of Congress to reject proposals that would convert Medicaid to a block grant or a per capita caps program. Lastly, cutting funding to programs that people with disabilities rely on would harm people and hinder opportunities for them to live in community settings. Our next key issue is housing. There's currently a serious shortage of affordable, accessible housing for people with disabilities and also for people with very low incomes. Many of the people that ANCOR members serve fall into both of those categories. The Section 811 Supportive Housing for Persons with Disabilities program, which is administered by the Department of Housing and Urban Development, focuses on developing and subsidizing rental housing for low-income people with disabilities. Increasing housing and access to housing for people with disabilities is essential to fully realizing the goals set forth by CMS's HCBS rule. Here are your housing talking points. Let your congressperson know that Section 811 is a successful program that allows people with disabilities to live independent and self-sufficient lives, which is one of the goals of the HCBS rule. Living in the community is more cost-effective than costly state-run institutions, so supporting Section 811 is not only good for people with disabilities, but it's fiscally sound. Lastly, ask your congressman or woman to support the administration's budget proposal of $177 million earmarked for HUD's Section 811 program. Our next issue is direct support professionals, often abbreviated DSPs, and workforce. As the population in this country ages, the need for paid supports is increasing. Providers are constantly challenged by inadequate rates to recruit, train, and retain a qualified professional workforce of DSPs. Unfunded federal mandates are worsening the problem of inadequate funding. Here are your talking points. Firstly, ensure that funding is adequate so that direct support workers are paid a living wage, including appropriate benefits. Your congressman should require that any state and federal minimum wage increases or changes in employment standards be reflected in state reimbursement rates for services. In other words, make sure that providers have adequate funding so that they can pay their workers appropriately. Finally, ask your congressperson to implement programs aimed at the direct support labor market to increase the pool of available workers in order to improve recruitment, retention, training, and supervision of direct care workers to better serve individuals with disabilities. The final issue that we're going to go over for 2015 is the DSP Recognition Week Senate resolution. You'll notice that this says it's for the Senate only. That's because to designate a week to honor a group or an individual, the Senate passes a resolution, the House is not involved. However, many members on the House side know about DSP Recognition Week and support it. So it's fine to mention it, just realize that it's only a Senate resolution, not a House resolution. DSP Recognition Week for 2015 will be the week of September 13th through the 19th. In years past, we've had strong bipartisanship leadership on DSP Resolution Week, and we anticipate that again this year. Senators Susan Collins, who is from Maine, and Ben Cardin from Maryland will be the lead co-sponsors. Additionally, we want to get as many co-sponsors to support the resolution as possible. So all you have to do, the only ask, is to ask your senator to sign on as a co-sponsor of DSP Recognition Week 2015. As mentioned earlier in this presentation, we've launched the new ANCOR Amplifier website, which will be your resource for Hill Day 2015. The link is amplifier.anchor.org/anchor/Hill Day 2015. You can also navigate to it by going up to the Resources tab at the top of the screen. You will have quick access to all of this year's information sheets, talking points, and leave-behinds. There's a link to set up your congressional appointments if you haven't done that already, and this training will also be available for download from that page. I hope you have found this presentation to be informative and helpful and give you the confidence to go out and have a great Hill visit. If you still have questions, feel free to drop us an email. My name is Catherine Burland, and I can be reached at kburland@anchor.org. You can also contact Esme Grant at egrant@anchor.org. Thank you so much for listening to this presentation. Go out and have a fantastic Hill Day 2015.